Can you hear and see me? Can you hear and see me?
Yes, yes, we can. Yes,
That's it.
yes.
Okay,
Thank you,
great.
Rhonda.
So are we letting people in right now, right? Or is it everyone's in?
Yes, people are joining. People are joining.
Fantastic. So let's start. Thank you so much, everyone, for joining. My name is Londo Maki, and I'm the president of the Public Health Association of South Africa. So today we're having quite an important topic, one leading to COP being held in Ethiopia, Addis Ababa in 2027, but also in terms of the current climate issues within Africa. And in terms of it, is at the front line of the climate crisis in terms of fossil fuels and health justice. And basically, in terms of experience, the escalating floods and droughts that we're experiencing in South Africa, I mean, in Africa in general, and also the food insecurity caused by climate, it was important for us as organization of Public Health Association of South Africa and also the African Federation of Public Health Association and also the Global Climate Health Alliance to have this important webinar and also to allow for the public health voices to come across and share and highlight this issue and see what possible solutions and what are the current issues with it. We have an exciting panel today. We also are graced by the Executive Director of the Global Climate Health Alliance, Jenny Miller. We also have Prof. Ademeya Hades from the Ethiopian Public Health Association, who's also the Professor of Environmental Health Engineering, Research and Publications Director. We also have the Public Health Association of South Africa, Climate, Energy and Health Special Interest Group Chairperson, Mafoko Pomane. And we also have a human rights scholar and training specialist in the Africa region, Mary Fall. And we also have Professor Abera Kumi, who's a professor of environmental and occupational health at Addis Ababa, and also works in a coordination of the project of GeoHealth. So that's our panelists for today. And I'd like to now move on with allowing inviting Jenny Miller to be able to just open it up in terms of just a few points. And I also have a direct question for her. And Jenny, from a global climate and health perspective, how do you see the climate crisis already affecting health across Africa, and what role does reducing dependence on fossil fuels play in protecting public health across the continent? Over to you, Jenny.
Thanks so much, Dr. Maki. I'm delighted to be here with all of you who are on the webinar and look forward to hearing from esteemed colleagues who will also be presenting today. So the climate crisis is not just an environmental issue. It's one of the greatest public health challenges of our time. It affects the air we breathe, the water we drink, the food we grow, the conditions we live in and that we work in. And increasingly, those of us in the health field are seeing the impacts of climate change showing up directly in our hospitals, our clinics, and the communities that we serve. This is especially pointed in across Africa. The climate crisis is already a lived reality for millions of people on the continent. Africa is one of the most, if not the most, climate impacted regions. And the continent has experienced the warmest decade on record with rising temperatures, intensifying droughts, floods, and extreme weather events. In 2025 alone, devastating floods in Nigeria's Mokwa region killed hundreds of people and displaced thousands of families. In South Africa's Eastern Cape and in Mozambique, severe flooding destroyed homes and infrastructure and led to significant loss of life. Unfortunately, these kinds of events are not isolated disasters. They are part of a growing pattern of climate instability across the continent and indeed around the world. And the consequences of this are really bad for health. Climate change is already increasing heat-related illnesses and deaths, particularly amongst people who work outdoors or more vulnerable populations, elderly populations, pregnant women. Malnutrition is rising as drought and crop failures threaten our food systems. Infectious diseases are moving into new places and expanding due to changing temperatures altering where those diseases can take hold and where the vectors for those diseases take hold. So malaria and dengue are being found now in places where they had never been seen before. Waterborne diseases follow floods and disruption to water and sanitation systems. And increasingly, we're coming to understand the serious mental health impacts when people are facing both the anxiety around climate change and the actual experiences of displacement and trauma from climate disasters. Health systems themselves are also feeling the strain when extreme events damage hospitals, disrupt care, stretch already limited resources, and when populations are showing up with new, different, unfamiliar issues or waves of issues, such as during a heat wave or a cholera outbreak. Africa contributes only a tiny share of global greenhouse gas emissions, yet it faces some of the most severe consequences of the climate crisis. So there's a real serious justice issue here. At the heart of both the climate crisis and also driving air pollution and other kinds of pollution as well is the same kind of upstream cause, which is the use of fossil fuels. Coal, oil, and gas extraction and transport and combustion are the largest sources of greenhouse gas emissions and are also a major source of air pollution and other kinds of toxic exposures that harm human health every day. These harms impact people across the entire life course, from before a child is born. For example, exposure to air pollution during pregnancy is linked to premature birth, low birth weight, and developmental harm. For children, polluted air increases the risk of asthma, respiratory infections, and impairs lung development. For adults, air pollution is a major driver of non-communicable diseases like heart diseases, stroke, lung cancer, chronic respiratory disease, and diabetes. So this is a lifetime of harm from fossil fuels. And these conditions are already putting an enormous pressure on health systems across Africa. So fossil fuels are really responsible for kind of, you can think of it as two layers of harm to people's health. First, directly through the toxic exposures through air pollution and contamination of water and soil around fossil fuel facilities, or when transport of fossil fuel creates spills and that sort of thing. And those kinds of exposures can damage nearly every organ in the human body, is susceptible to the toxicity from fossil fuels. And then secondly, because they are the primary driver of climate change, they drive the health risks associated with heat, food insecurity, disease spread, extreme weather, et cetera. So that's why we really believe that the health community has a critical role to play. As health professionals, we are some of the most trusted voices in society. When doctors, nurses, and public health leaders speak out about climate change and about fossil fuels, the conversation shifts, and it shifts from a conversation not just about emissions or our energy systems, which are important and interesting and compelling to some people, but it really turns the conversation to human lives and human futures, which are of concern to all of us. So in other words, I would say that protecting the climate is protecting health, and reducing our dependence on fossil fuels is critical to protecting the climate, preventing health harms, and because of that is one of the most powerful public health interventions available to us today. Back to you, Lawanda.
Thank you so much, Jenny, for the great words and also sharing a nice perspective. I think I just want to invite all the attendees and participants that you may ask questions and put them down in the chat as we go by, and we'll give an opportunity for some of the speakers to address it. I'd like to move on to Prof. Alevidu Hades, Professor of Environmental Health Engineering and research publications at the Ethiopian Public Health Association, a partner of the Public Health Association of South Africa, and also the African Federation of Public Health Association. My question to you, Prof. Hadas, is from your experience in environmental health research and policy in Ethiopia and across Africa, what are the most urgent health risks linked to climate change and pollution that public health leaders should prioritize today? Over to you, Hadas. Hadas, you're muted. Your microphone's on mute.
Yes.
Thank you.
I think it's darker. And the room I'm in is, I think, darker, but okay. Thank you very much. I'm not, I cannot talk much probably because my respiratory system is not working properly, but I would like to do my best. So that's a very good question, excellent question. But to answer that, we need to have a kind of background. As fossil fuel use they used to be formed millions of years ago, but the use of fossil fuels as source of energy is very recent, since 200 years. And people are becoming very much dependent on fossil fuels, especially people all over the world for energy source. They usually...
Hadas, sorry.
Yes?
Switch
Can
off
you
your
hear me?
Yes, we
Sorry?
can hear you. Just switch off your camera because we can't see you clearly. You can switch off your camera. Then, that's much. Well, if we, yes, leave it like that. That's perfect. Go ahead, yeah.
Or let me change place. Maybe.
We can see you clearly. You can take a seat.
Can you see it now?
Yes, well, now it's gone dark. It's fine.
It's turned off.
You
What
can
about
turn
now?
it off, leave the camera off and carry on talking.
Okay.
You can go ahead talking.
Yeah, sorry. So the good news about fossil fuels is that at the current rate of abstraction, they may be depleted soon. So people need to have an alternative source. And that's why big companies like Shell are now working on alternative sources of fossils. Otherwise, still most of the sectors globally are using mainly oil, gas, and coal. Most energies are coming out of it. There are efforts like here in Ethiopia that we are trying to use hydropower as a source of energy. So there is a shift towards a sustainable way of using energy, substituting energy. I'll come back to it later. So Africa remains heavily dependent on fossil fuels, which accounts to roughly 95%. And we don't really see a clear shift. Despite advocacy for the last couple of decades, we don't still see much shift from fossil fuels to renewable source of energy. Because of this, Jenny has already mentioned that people are exposed to different forms of health and environmental problems. I will not repeat that one. So as the question that you raised is very good. So what should we do? Okay, with all these health problems, we cannot continue this way as you know, with all these health problems. So people have to quickly act. And this is a theoretical, it has been theoretical so far, but a reality comes with the I was reading an article on Operation Epic Fury, which is a live war, global war in the Middle East, which may intensify. I wish not. Otherwise, burning of all these oil fields, missiles, and a lot of things that are coming out of it are heavily damaging human health and the environment. Maybe probably the last 20, 40 years efforts to combat, to curb climate-related problems might have been offset by the current activity that we are doing. So what we need to do is, quickly substitute fossil fuels with biofuels, which is fuels derived from crops and waste, including agricultural waste. That's one, that could be one approach. The problem, it may be expensive, but compared to the health impacts and the environmental damage that the current practice poses, may be less cost effective. The second one is shift for more sustainable and renewable energy sources like hydropower, solar energy, which is the future of hope. And the hope of the future, and that relies mainly in sub-Saharan Africa. So big companies like Shell are now contemplating to intensify solar energy around the equator in sub-Saharan Africa and so on. So that may be the future energy hub that can substitute fossil fuels. A very strong recommendation, difficult to take up, but the one that we should do is that we have to establish a world order that's friendly to humankind. Now, with the practice that we are doing these days, it's foolish, it's nonsense to talk of climate change. We are killing ourselves. We are killing the generation. We are killing our brothers and sisters. So to me, the very first commitment of every government should be to, protect its citizens from climate exacerbating activities like war and so on. So that should be the very first commitment. And then, in a few years ago, we used to hear the green movement, environment clubs, and so on. We are not listening them these days. We need to strengthen and empower these environmental clubs and teams if we want to save ourselves and the environment. And lastly, I think African voices, as Africa is the one which is being highly affected by climate change, unfairly, because Africa is not contributing much, but the impact is highly observed in Africa. We need to have a platform where African voices should be heard at the international media and platforms. Thank you very much. Back to you.
Thank you so much for sharing some of your points there, Hades. As you heard, we need to move towards cleaner energy sources, recognizing also with climate finance that Africa doesn't have much contribution to the overall climate crisis, but we have massive impacts happening. And we should make sure that we do get the financial support from the global community to be able to adapt and also mitigate these dangers of climate crisis. I now want to go to the next segment, which is the African context and lived realities and health inequalities. And we'll start with Mafoko Pomane, who's the Climate, Energy and Health Specialist Interest Group Chairperson at the Public Health Association of South Africa. So Mafoko, drawing from your experiences across different African regions, could you share examples of how climate change and fossil fuel-related pollutions are affecting frontline communities and health systems, and what these realities tell us about the development pathways Africa should prioritize going forward? Over to you, Mafoko.
Thank you. Thank you, Dr. Maki, and greetings to everybody. I hope that I'm audible. I think Jenny earlier referred to the social determinants of health and really highlighting that the conditions in which people are born, live, grow, and age, as well as the distribution of power, resources, and opportunities, significantly influence exposure to fossil fuel pollutants and other and their impacts. Most vulnerable communities often live close to polluting industries. Fossil fuel activities are known to occur in what's referred to as sacrifice zones. And these are extremely contaminated areas where vulnerable communities are already marginalized, and they already bear the disproportionate burden of health, human rights, and environmental consequences. And so exposure to pollution and hazardous substances is rife in these areas. And so communities that live close are most vulnerable. I think it's been said that climate change is a major threat to global health, and exposure puts people's health at risk. And the science is clear. And unfortunately, the human cost is visible. Jenny also referred to air pollution as a major consequence. And we know that it is linked to maternal, adolescent, and child health, and children's exposure to pollutants from coal, from oil, as well as gas, really are dire in that they're linked to low birth weight, as mentioned, preterm birth. We know respiratory illnesses such as asthma and pneumonia, as well as cognitive development and cardiovascular diseases in adults. In the older adult population, we know that they're already quite vulnerable, and they have pre-existing chronic diseases, and they have that cumulative exposure to pollutants. And so we hear community testimonies from health impacts from South Africa's coal-fired power stations to oil spills oil spills that cause sickness and death in the Niger Delta. And really, the revelation is around the extent of the suffering that is caused by fossil fuels and the dependency that we currently have. Jenny also referred to the rising temperatures, which are causing floods and really pushing vulnerable populations to the brink of survival. In Southern Africa, particularly in countries like Mozambique and Madagascar, including South Africa and Zimbabwe, Malawi, and Zambia, have been experiencing severe climate change-related flooding and cyclones, which have caused deaths, as well as displacements, as well as the destruction of their homes and livelihoods. And these heavy rains and flash floods have nearly impacted 1.9 million people in Southern Africa alone in recent months, as well as in the last couple of years. And further rainfall is still being forecast, and so flood risks remain high. And this compounds food insecurity as well as the risk of disease outbreaks rather. And this unfortunately also disrupts routine health services. Also, we know that this causes puts a lot of pressure rather on critical infrastructure such as roads, such as bridges, schools, but particularly health facilities. And communities are left isolated, and there is restricted access for humanitarian services to support them. So all of this is clear. It's linked to fossil fuel extraction. It devastates ecosystems. And really, the cries for climate justice are echoed from every corner of the globe, but particularly here in Africa. Looking at developmental pathways that can be prioritized, the just transition away from fossil fuels cannot be overemphasized. People's health is at stake, and we really need to draw on rather precautionary principles, which really entail taking action and preventing harm that is needed. Looking also at issues related to climate and health data, there are significant gaps, climate and health data gaps, which exist particularly in low middle income countries. And these gaps are most pronounced in Africa, where, as it's been said, vulnerability to climate change is at its highest. And so it is critical to invest in generating climate and health data as it supports, mapping and predicting mitigation efforts. And often we know that there's underreporting of the health impacts of climate change. There's growing research in areas of heat stress, but more research is needed. And so data is really paramount in highlighting the impacts related to malnutrition and vector-borne diseases that have been mentioned. So with regards to data, really, we're wanting that the burden of proof needs to shift away from communities that are already experiencing harm. And we need effective evidence-based mitigation and adaptation strategies, and these require data. I think it's also important to invest and initiate in community-led health research and action in areas affected by fossil fuel activities. Bringing scientific data and lived experience becomes important in designing interventions. At Groundwork in South Africa, we draw on community participatory research methodologies, and as a way of highlighting how impacted communities are experiencing air pollution consequences in hotspot areas such as Mpumalanga. We're also finding that investment needs to be geared towards community health screening programs, specifically in communities that are impacted, that live close to polluting industries. And community health screening interventions will provide a better understanding and comprehension of current health status and what the community needs as far as health interventions is concerned. And I think Jenny also mentioned the need for health professionals to really be in the front line. They are key in humanizing the health impacts of fossil fuels by sharing first-hand accounts from their patients and communities. And they play a central role in mitigation and adaptation efforts, but particularly in advocacy. And so it's imperative that health professionals are prepared to respond to the climate crisis from all levels, particularly systemic levels. And the health costs that are embedded throughout the fossil fuel life cycle need to be exposed, and health professionals are well positioned to do so. So just lastly, at the Public Health Association of South Africa, we, together with partners Healthcare Without Harm, we developed a guidance document for health professionals on climate change and its health impacts, titled Suffocating Under Fossil Fuels. And we realized the need for health professionals to have extensive exposure to the full spectrum of climate and fossil fuel related health impacts, but also the legal obligations of countries and corporations that can lead to accountability as well as action and justice towards this just transition. And then lastly, the health sector also needs to lead by example. It holds considerable influence and needs to also then look towards decarbonizing the healthcare system itself by divesting in fossil fuels, but adopting sustainable practices in order to ensure that we are also not contributing to the problem. So the need to accelerate fossil fuel phase out is really a key role by the health sector to lead by example. And we need health systems that are resilient and prepared to address the climate-related disasters that then ensure the continuity of care. So some of these actions really will enable the health sector to lead in this just transition toward a healthier and equitable society-wide transformation. Thank you, Lwando. I'll leave it there. Thanks.
Thank you so much, by the chairperson of the Public Health Association of South Africa's Special Interest Group on Climate. In terms of, it's very important, as an organization, not only in South Africa, that in Africans, we need to make sure we address this climate issue, especially for the communities, and also shared by Mafoko in terms of the work of groundwork, getting the voice of the communities coming out and highlighting it, and not only in climate, but also in the environmental and chemical space, and really do appreciate those members who contribute to the climate energy sake. We're going to move now next to the next speaker, and that is Speaker Mary Fall, who is a PhD on human rights scholar and a training specialist in African human rights. So Mary, with important international developments such as the ICJ advisory opinion process, alongside evolving climate jurisprudence within African human rights frameworks, how do you see these legal shifts shaping the protection of the right to health and the right to the healthy environment, and what opportunities do they create for public health advocates in Africa? Over to you, Mary.
Thank you. I'm coming through okay?
Yes, you're loud and clear in your audio and
Thank
visuals.
you. Thank you very much for having me, and Naki, and thank you very much for this excellent question. So let's start with the ICJ. On 2030 July 2025, the International Court of Justice released its blockbuster climate opinion, 133 pages that essentially boil down to one simple message: countries have to set up their game. The opinion articulated state climate obligation under international law. Significantly, the World Court recognized the inextricable link between human rights and climate change. According to the court, climate obligation go beyond the Paris Agreement, which requires states to limit global warming to 1.5 degrees, ideally. It said that climate obligation come from all sort of other places too, including Human Rights Convention, environmental agreements, the law of sea, general principles of international law, and more. Importantly, the ICJ emphasized that even countries that haven't ratified the written agreement are still bound by some climate obligations, like to prevent significant harm to the environment or to corporates. These rules are rules of customary international law, which binds all states, treaty or not treaty. The ICJ also made a very, very important point regarding fossil fuels. It said that states cannot simply continue producing or supporting fossil fuels like as if nothing were happening. It said that states can be held responsible for producing or using fossil fuels, authorizing further exploration or providing financial support for fossil fuel activities. And also it emphasized that states must stop companies that are doing things that weaken climate efforts. And I would like to say that these legal developments at the international level resonate strongly with African human rights jurisprudence, which has long recognized the close relationship between environmental protection and human health. First, in 2001, in the landmark case in Serac versus Nigeria, the African Commission on Human and People's Rights addressed environmental pollution caused by oil companies in the Niger Delta and its devastating effect on the health of the Ogoni people. In that decision, the African Commission emphasized the connection between the right to health protected under Article 16 of the African Charter on Human and People's Rights and Article 24 of the African Charter, which guarantees the right to a healthy environment. It said that one right cannot be enjoyed without the enjoyment of the other, and also clarified that African states have imposed Article 24 of the African Charter imposes clear obligation on African states. In particular, they are required to take all reasonable other measures to prevent pollution and ecological degradation. They also must to protect their citizens from environmental harm caused by businesses. And more recently, in 2023, in Ligue Ivoirienne des Droits de l'Homme versus Côte d'Ivoire, the first environmental case before the African Court on Human and People's Rights. The Arusha, in this case, the Arusha Court dealt with the dumping toxic waste in many sites in Abidjan, linked to the company called Transfigura and its severe consequences on the health of many people in Abidjan. In that case, the Arusha Court reaffirmed the nexus between the right to health and the right to a healthy environment. It said it reaffirmed that African states have obligation to take all necessary measures to prevent pollution and ecological degradation under Article 24 of the African Charter. And importantly, it said that African states must protect individuals within their jurisdiction from violation of the right to health caused by businesses. And I would like to, looking ahead, the forthcoming climate advisory opinion of the African Court is expected to further clarify African states' obligation in relation to climate change. As you may know, on 2 May 2025, PALU, in collaboration with other African civil society organizations, requests an advisory opinion from the African Court to clarify their African state obligation with respect to climate change. So the request asks the Arusha Court to clarify African state climate obligation under key African human rights instruments and several provisions of the African Charter, including Article 16, which guarantees the right to the health, and Article 24 of the Charter, which guarantees the right to the healthy environment. And I would like to highlight this, that in the Ligue Ivoirienne des Droits de l'Homme versus Nigeria, the African Court said, importantly emphasized that businesses have the responsibility to respect human rights, including the right to health and the right to the right to a healthy environment. So from human rights, from public health advocates, I would like to say that these legal developments present significant opportunities because they offer powerful legal tools to frame climate not only as an environmental challenge, but also as a public issue. And they also open avenues for public health professionals, civil society, and affected communities to use the law to demand stronger climate action and to hold both states and corporations for harm to health and the environment. And finally, these developments offer important pathways for advancing climate and health justice across the continent. Back to you, Mikey.
Thanks so much. It was really interesting, and we have a few questions in the chat, and we're going to get to that now. But we just want to maybe finish and let all the speakers be able to share. Then we can have a nice discussion. So please, participants, we do acknowledge your questions, and we're going to be able to have a very fruitful discussion. We just want to move now to the parts related to COP 2027 Ethiopia and the role of health at that COP. As a Public Health Association of South Africa, we definitely, with the Ethiopian Public Health Association, we're collaborating and having an MOU signed for us to be able to go forward in terms of making sure we have a fruitful COP at Addis Ababa. And we definitely will trickle into the special interest group of the climate, energy, and health and their counterparts in the Ethiopian Public Health Association. So it's very, very positive with also the support of the Global Climate Health Alliance. And with that being said, with the Global Climate Health Alliance, I'd like to ask Jenny Miller. Jenny, as we look ahead to COP 2027 Ethiopia, why is it important for the health community to play a stronger leadership role in climate negotiations? And how can health evidence help shape a more people-centered climate agenda? Over to you, Jenny.
Yeah, thank you so much, Londo. So even though it's really clear, I think, and increasingly clear to those of us in the health community that climate change is a public health crisis, I would say that the health implications of the decisions that climate negotiators make when they're at the talks, that the health implications remain underrepresented in the talks. People are not thinking about those when they're carrying those negotiations forward. The importance of that health framing is that it actually helps translate positive climate action into benefits for human beings, lives saved, disease prevented, healthier communities, and conversely, if those actions aren't taken, highlights the impacts and the threat that climate change poses to people, to communities. Health professionals, as we have noted a couple of times, are very trusted voices and have kind of unique credibility to advocate for stronger health policies from a health perspective. And the health evidence actually makes the case that phasing down and phasing out fossil fuels is a public health intervention. And that's been a very contentious issue in the climate talks for many, many years. And so I think elevating health in the climate negotiations can help shift the conversation from very abstract, emissions targets to what this means for people, and really center it on what it means for people. I think there's some really key strategic opportunities for the African public health community and African public health associations going into the COP in Ethiopia. There's time, like we have over a year and a half before that COP to position. So that's plenty of time to actually position African public health leaders as key voices shaping that COP agenda, and particularly making those links between climate and health equity and development. To actually have that impact, I think it's going to be really important to work together and build alliances, not only between public health associations, but also connecting with medical societies. And there are a number of really dynamic civil society groups in the region. And so bringing a joint, strong African health voice to those negotiations. There are some national processes that can also have an influence that are connected to the COPs and the international processes. A couple of them that I'll mention that are really important are the development of what are called NDCs, or nationally determined contributions. So that's each country's own national climate plan under the Paris Agreement. And then there are also national adaptation plans. And not all of these are thinking about health or integrating the health co-benefits that can come from climate action, or the health impacts that we might see without good resilience and adaptation. I think beyond sort of Africa, I think every one of us in the health community should be advocating for increased high quality climate finance to support the range of climate actions needed, particularly in developing or under-resourced countries, to protect health. And that means, greater finance for resilience and adaptation, for resilient health systems, and also to support mitigation action. And it also has to be finance that doesn't create a crippling debt burden for countries, because we've seen the harm of that over many years. And also, to be high quality, it really needs to be accessible and needs to get all the way down to the communities that need it the most. And then finally, I think it's really important for us to think carefully about how we ensure that evidence informs the COP agenda, and health evidence specifically. Evidence by itself doesn't change policy. It needs to be delivered to policymakers in forms that they can access and use and understand by trusted messengers. And we in the health community and African public health leaders leading up to that African COP in Ethiopia have a clear opportunity to translate health evidence to elevate the opportunities for clean air, climate resilient health systems, stronger protections for vulnerable populations, and to support the call for a just and equitable transition away from fossil fuels, highlighting the health benefits of clean energy, and the steps needed to get there in a way that is equitable and just. And then finally, I think there are real opportunities as a health community to highlight and elevate community testimonies and the lived experience of communities feeling the worst impacts, or whether that's of climate change or the fossil fuel industry, to humanize what that really looks like. So I think there's a tremendous opportunity to use the COP in Ethiopia as an opportunity to position Africa as a global leader in advancing a health-centered and justice-driven climate agenda. There's the case is there to be made, and with strong advocates from the health community, I think it can really make a big difference.
Thank you so much, Jenny. We're just going to go to some of the questions. I see some speakers have 2 questions, so we'll start with 1 question each. So this is from Hassan Mohammed. In a recent address in the European Union, the Secretary of State for the US government, Mark Rubio, referred to climate crisis as a climate cult. Can the panelists comment on how can this be addressed in terms of this climate cult comments, in terms of false information? So that's open to everyone. Maybe we can have anyone can pick up their hand. Maybe Mafoko, you can go first.
Thank you, Lando. I think, we are aware that there are climate denialists, and we cannot ignore the kind of disinformation that comes with the denialism. And it's unfortunate when it is leaders that are influential that are, part of the disinformation and denialism. And so it really signifies the need for the health voice, particularly to counter some of this misinformation, because we cannot deny the health evidence, we cannot deny the health impacts, and the science is clear in relation to what communities are experiencing, but particularly in relation to what we're seeing as far as extreme weather events, as far as disease outbreaks. So there's the disinformation and there's the denialism, but the evidence is clear that's pointing to the impacts of climate change. And so we need to work hard to ensure that we counter the misinformation at all costs. And so influential voices are needed in this regard, and particularly health professionals. And really that in order to make a strong health argument to counter the misinformation and the denialism. Thanks, Lando.
Thanks. Is anyone else wanting to add on to what Mafoko has said? Go ahead, Jenny.
Yeah, as the one US-based speaker on this event, I feel like I have to say something, which is that we currently have an administration that is an absolute disaster when it comes to not only climate change but global health and so many other things, international security and peace, many things. I absolutely agree with Mafoko about the need to counter the disinformation, which is what that comment is. But they're also in the US rollback of domestic policies and the withdrawal from the UNFCCC and the withdrawal from the World Health Organization. In the US, I think we who live in the US have a huge responsibility to change the administration, and there are people organizing, and people in the health community are trying to keep the ball moving down the field on climate change. I think there's a lot of organizing happening to try to counter this administration. Also, we're seeing that this administration's policies are not that domestically popular. I am hopeful. It's not a sure thing. It's complicated, and I don't know what will come of the next elections, but I'm hopeful that we could see a change of administration. But then in the meantime, internationally, we've got to be working together, for both folks based in the US that have a view on the ultimate goals, collective goals, and our allies and partners globally. And we just have to go around. While this administration is in place, we have to keep this work moving by going around them and build other areas of leadership amongst other countries, and show that this work moves forward with or without a very problematic United States.
Thanks there, Jenny and Mafoko. We'll move to the next question by Velile Ngidi. Her question is, with current geopolitical realities, our declining ability to hold big economies to account for their contribution to carbon emissions and the related climate impacts, what can the countries in the global south realistically do to prepare for what now seems to be an inevitable future of climate-related disasters? We clearly cannot afford the scale of response and recovery in the horizon, and some suggestions of locations within Africa, South Africa. But essentially the question is, what can we do with the little that we have? Let's first go to Prof. Hadis in terms of what can Africa or the Global South do to address the climate crisis with lack of resources in terms of finances. And then we can also hear from another speaker related to that question. So go ahead, Hadis. We can see you. And we can...
Can you see me now?
Yes, the question is, how can African countries or Global South countries or lower economic income countries address climate crisis with lack of resources, specifically financial?
Yeah, sure. That's the major challenge. The climate crisis in Africa is difficult to be addressed by Africans themselves. And probably the speaker from the human rights would agree with me that this challenge should be solved together with the international community. There has to be fairness and equity, and there should be a climate fund where Africa would try to make climate adaptation. There were a lot of pledges on climate funding for Africa, that what is already available is very very small, very minimal, that cannot do much. But that doesn't mean that we have to rely on international support, and we should not externalize it. We need to try to make our local, Africa's local wisdom to make adaptation to climate change. There are a lot of experiences local that need to be scaled up at different nations. For example, in Ethiopia, we have a community in southern nations that are very much specialized in manipulating their environment for to mitigate climate. Not necessarily, they are not aware of it will mitigate climate change, but they want to conserve water and other natural resources. But that is very useful to make climate adaptation. The other thing, we have communities which are mostly pastoralists living in drought-prone areas. But we have to think of, for example, changing the livelihood, the lifestyle, the way they cultivate, the way they grow their crops, the types of crops they choose to grow. So new approaches, new dimensions have to come. So there are a lot of efforts in Africa, local. One of the best ways would be to identify this local wisdom and practices and scale them up in addition to what we're working with the international community to increase the capacity of Africa to adapt to climate change. Thank you. Back to you.
Thank you, Aris. And then just the final question is related to the ICJ advisory opinion. So, Mary, the question is related: how can African countries or global South countries can bring about real change through the advisory opinion of the ICJ? Go ahead, Mary.
Thank you for the question. So, regarding the ICJ advisory opinion, what we are expecting from the African state is to adopt climate legislation, which set clearly how to mitigate, how to adapt to the climate crisis, but as well as to regulate corporation activities, and how to also apply, how to ensure or to implement the application, the Paris Agreement. I saw a question regarding the African Court. One of the participants asked if whether public health professionals were involved in the Paris advisory advisory opinion. I would like to say that I have no information if public health professionals were involved in that request, but there still room for public health professionals across the country to file what we call amicus brief, so they can provide their contribution to the forthcoming advisory, which will be a landmark advisory opinion, and which will be a blockbuster climate opinion, which we all are awaited, which we all expected that will clarify clearly African state obligation regarding climate crisis under several African key human rights instruments.
Thank you so much, then, Mary. So everyone, folks, we've come to the end of our day, of our webinar. And we really want to thank all the panelists who attended today and everyone else who also took time to attend wherever you are in the world. And it highlighted the fundamental issue of climate being a health crisis. And also it highlighted the growing scientific evidence linking fossil fuel pollution and the climate change to serious health harms across the continent. And we've had some great points in terms of the latest legal advice that's there related to the ICG for Mary. Mafoko had highlighted the communities. Hades had also shown examples of how we can address climate change with lower resources. And also Jenny had highlighted the opportunity that we have next year through the COP. And we can try to make sure that we have a clear African united voice at the COP 27. And then from African Federation Public Health Association, we definitely will have involvement at the COP with also the Public Health Association of South Africa and the Ethiopian Public Health Association and other African associations that participate. And we will be contributing towards the activities which will be done and coordinated by the Global Climate Health Alliance, which always has a very strong presence of a health community coordination at all the COPs. So I'd like to thank everyone. We will have the recording shared. Thank you so much and have a great day. Thank you. Goodbye.